Deonandan. He's an epidemiologist and associate professor at the University of Ottawa. Good afternoon.
Good afternoon. How are you?
I'm fine, thanks. We've been hearing a fair bit of talk about society paying this immunity debt as pandemic restrictions are lifted. Kids are finally getting some of the illnesses that they weren't able to get or to develop immunities to over the past couple of years because of restrictions. You've got some exceptions to that explanation, though. You're not entirely happy with it. Can you explain that for me?
I'm not. First of all, the term immunity debt really didn't appear in literature until like 2021, so it seems to be a recent development. I have problems with this narrative for at least three reasons. One is that we're seeing the same overrun pediatric hospitals in places where there were minimal COVID restrictions, like red states in the USA, Texas, Alabama, Oklahoma, Florida, etc. Number two is we actually had a bigger RSV wave in 2021 when restrictions were removed then, and the pediatric hospitals weren't overwhelmed then. So the test positivity rate right now, I think, is around 4%. In 2021, it was 10%, suggesting that there are more cases. What's different now is that fraction of cases which are serious is much higher. So that fraction of cases requiring hospitalization is greater. So something is happening to create a susceptibility to the bad outcomes of respiratory viruses now that wasn't happening earlier. Now, the prime candidate for that, of course, is COVID. It could be something else, but it makes sense that it might be COVID. Some immunologists are suggesting that COVID might be compromising the immune systems of people who are even mildly infected. Again, nobody knows for sure. That's a theory that's put out there. But I think arguing that this immunity debt situation is what's driving all of this, I think it's poor reasoning.
And what do you think, as someone who considers how ideas about illness, are themselves spread? Why might that narrative be comforting or popular or more successful ultimately in the context?
Well, I mean, there's probably a little bit of truth to it. It might be driving some of the infection rate, just not the hospitalization rate. And it's an easily understood narrative, but I think there's a political motivation in some circles as well to blame pandemic restrictions for this and to justify the reopenings at all cost. So it's hard to disentangle the science from the politics, as it is for everything throughout the last couple of years when talking about respiratory illnesses.
Okay, so I mean, viruses like RSV, as you say, are always circulating. But you think there might be something more at play here. Can you go any further with that about why we might be seeing more serious cases?
Right, so this is not my area of expertise. Some immunologists were suggesting as early as 2020 that a COVID infection might be compromising many organs in our bodies, including our ability to respond to infection in the long run. If that's the case, we're looking at a serious long-term disability issue affecting the entire population for years to come. That's terrifying. We don't know for sure. It's something that needs looking into, and to my mind, the precautionary principles suggest that we should be doing everything we can to prevent further COVID infection, if that might be the case, until we figure this out. So there are some solutions on hand for preventing or at least slowing the current crisis in our hospitals. We have to fix it with masks and clean air, frankly. This is a supply and demand issue. We have insufficient supply of healthcare to meet the demand for healthcare. We could look at it from the supply side, which is, hiring more nurses and changing some of the telehealth billing codes to make sure that people can use better triage before crowding the ERs. Maybe moving some of the people occupying beds who are chronically ill into home care and paying for that. That's not going to solve the problem right now. Right now, we have to stop the demand. So mask wearing is the simplest, fastest way of doing so. And then we work on the supply side after that.
We've been hearing Ottawa's Medical Officer of Health, Dr. Vera Etches, say that we're heading into, she says, a challenging season. We know that the city has already confirmed its first influenza outbreak, and that's come a month earlier than we would normally expect to see it. And I wonder what you're thinking about that, the additional strain that there might be on pediatric care specifically as we get deeper into flu season. And let's face it, when the weather kind of catches up with the calendar. Right now, it's people perhaps are outside more than they will be if the temperatures suddenly go to where they're supposed to be, 0 or a less comfortable outdoor temperature.
It's deeply concerning. We haven't seen the full brunt of flu season yet. The peak is still coming. and the uptake of the flu vaccine is poor. So I'm encouraging every parent out there to get your child vaccinated against the flu, get yourself vaccinated as well, and get your child vaccinated against COVID. The uptake of the pediatric COVID doses is quite poor. And I understand why that is. Some people feel that kids don't get that sick and so forth. But so many are getting infected now that that fraction who will get seriously sick is considerable. So if you can reduce that probability, please do so. So there are things that we parents can do right now in addition to start changing our behaviors to minimize exposures if we can. That includes wearing a mask when we go into public indoor spaces. But to answer your question directly, I'm deeply concerned. If we're seeing this level of crisis and chaos in the hospitals now, it's only going to get worse unless some policy levers are pulled now to slow that chaos.
I understand that you and your wife made the decision today to keep your toddler home from daycare in light of what you had been seeing at CHEO. I wonder if you can walk me through the decision that we would have overheard in your house if we had a microphone there,
Right.
So that it might guide other people who are likely to be facing similar calls.
So I'm in a privileged position. I work from home, and my wife is a doctor, so we have resources and the ability to keep my kid home. Like I work through the night to make sure that my slate was clean today so I can take care of my kid myself. Many people don't have that option. They must take their child to daycare. But for those of us who have the option, we should be exercising that option. Now, I'm not afraid that my kid is going to get COVID or RSV. I mean, most will do quite well with that. I'm more afraid that if he doesn't do well, if he requires hospitalization, there's no space for him at the inn, right? Or if he gets an injury, he breaks a leg or something, and we have to take him in for the ER, that's a 20-hour wait to find care. That's not worth the risk in my mind. I'd rather see if we can wait while decisions are made to create more space in the healthcare system. I really feel for parents who don't have that option that we have. And so we have to, as a community, make choices to make sure that when kids need care, care is there. The healthcare workers are doing everything they can. CHEO is phenomenal. They're really making very good decisions and working very hard at this. But they need the support of the community and of government to make good choices to limit the demand on their resources.
What do you think about this decision to move teenage patients to adult critical care beds to kind of free up space for the preschoolers, it seems, who are turning up in numbers at CHEO? Will that be enough to create some headroom, as it were, in front of this?
It's going to help, absolutely. Will it help enough? Who knows? And it's not ideal. Kids are not small adults. Kids need specialized care. We don't have a lot of specialized care for a pediatric population. When a child is cared for by a specialist for adults, it's a possibility of missing some things. So it's concerning, but it's unavoidable. And will it be enough? I don't think it's going to be enough. The flood continues to come in to overwhelm the system. We have people getting care in hallways and closets and places like that. We have nurses in tears. Confounding all of this and making it even worse, of course, is the human resources crisis of the staff being off sick and leaving in droves and stressed out in general. So we have both diminishing resources and increasing demand on those resources. We're being hit hard on two ends of this problem.
Raywat, as usual, nice to have your expertise on this afternoon. Thanks for your time.
My pleasure. Thank you.